Okay, so if you're all seniors and you've been around town and have seen all the large communities and you've heard about smaller ones, you know, the independent ones. If you live here in the Sun City area, there's plenty of the independent ones. If we could go back one slide. Okay, so there's the independent, the types of senior living is independent, where you don't need any assistance with any of your activities of daily living, which are, and these are determined by an insurance company if you have a long-term care policy. They generally ask you to have two needs before they will pay out benefits. And those activities of daily living are dressing, help with dressing, and it could be as little as just helping somebody put on their Ted hose. It doesn't have to be the complete head to toe. It's just help with dressing, bathing, and that could be as little as helping somebody safely get in and out of a shower. It doesn't necessarily have to be hands-on shower, physically, you know, washing you, scrubbing your back, washing your hair. It's getting in and out of the shower safely. Transferring in and out of bed into a wheelchair, back into bed, medication management, incontinence care if somebody needs help with their activities of daily living. And then there's assisted living, and that's help with all of that I just mentioned, or something just not wanting to cook anymore, or drive. Maybe your vision has been impaired and your doctor has suggested you give up your license. Well, nobody wants to hear that, but at both independent and assisted living places, they have scheduled transportation to doctor's appointments, to grocery stores. Not that you're buying a lot of your own groceries, because with assisted living, you're getting your meals, but it's available. At the independent places, they're taking you to the fun activities, the ballparks, the casinos, surprise visits up to Sedona for a day. So they do fun things like that. Then there's memory care, which, you know, self-explanatory. When somebody becomes unsafe to live either in their own home, in an independent community, or assisted living, they could live in assisted living for a while with a diagnosis of mild cognitive impairment. You know, maybe they're just having trouble forgetting names, or maybe they're forgetting to take their meds. I'm sorry.
Touch it up. I saw it though. I got to touch it up.
It's okay. I'm muted, people. Some people weren't muted properly.
I didn't know if somebody was asking me a question.
We're good. We're good.
Okay, no worries. So when they become a harm to themselves, of either constantly leaving their home, you know, you get the PORA, what do you call it? The posse, that are constantly, you know, reminding the family that they found their loved one, their mother or father. Then it's time for a memory care community. And then there's skilled nursing, which is covered by Medicare. And it's usually well, depending on what the skilled care need is, most rehabs will, through Medicare, cover up to about 20 days of care. Sometimes they extend it, but most times it doesn't even last the full 20 days. They will ask you, if you're not able to go home, they will tell your family or your spouse that it's time to look for assisted living. And then the last kind encompasses all of what I just mentioned: a continuing care retirement community, or they're called life care communities. Those are the ones that you have here through Sun Health. That's the Colonnade. It's and they have assisted, they have the memory care and skilled nursing, all part of their campus. Okay, we could go to the next slide. Assisted living, was there an independent one before? Yeah, if you can go to the independent slide. I think it's one before that one. Yeah, there we go. Most independent living places take people at 62 years of age. Very few, even though I guess technically you're considered or can be considered a senior at 55, Most of the places do ask the residents to be 62 years of age or older. You've got to be physically and mentally healthy. And rather than being month to month, like assisted living is, they typically sign a 1-year lease, and then you pay just monthly rent. And if you can get out of that lease, if you require a higher level of care, say you move into a brand new, well, it's not brand new, but it's brand new to you, a new independent living community, and you have an incident within the first year, well, you don't necessarily have to live out your whole year there. If you need a higher level of care than they're able to provide for you, you can get out. Now, the caveat there, though, is if you are moving into a community that has both independent and assisted living on the same campus, they would want you to move into their assisted living, and the push would be very strong for you to stay there and move into their assisted living. So you'd have to read the fine print on the contract on that. But you could usually get out with a 60-day notice to break the lease. And these notes are a little bit dated. Last year, you could get something for maybe starting range 1,500, but since COVID, and I know this is an excuse you're hearing all around the world, it's just hard to get workers. It's hard to find people that want to come to work. So in order to attract really good workers, they're having to pay higher wages, of course. So now it's very difficult to find something in the 1,500 range. I would say look at independent to start at around the 2,000 range and above. Okay, next. So with assisted living, if you're looking at a community, they will always have their nurse come out wherever you're at. If you're at the hospital, if you're at the skilled nursing facility, or to your home, and they'll do an assessment, and they'll make sure that you are appropriate for their type of assisted living, because maybe you need a higher level than they're able to offer you. There's different levels of assisted living. For instance, most or a Hoyer lift transfer. Some of them do, but most of them don't. If that's what you require, at that time, we would have to look at group homes, which is also assisted living. They're both licensed under the same licensure through the Arizona Department of Health for the highest level of care, which is called directed care. There's 3 levels of care in Arizona: supervisory, and that just means kind of watching to make sure that somebody is getting their meals, and they could go down to maybe the one of the offices to have somebody take their blood pressure reading. It really is just superficial supervisory care. The next level is personal care, and that means anything of the person. You're touching, helping them bathe, dress, incontinent care. That's personal level care. And directed level of care, in Arizona, they say if the person is able to recognize danger, so a burning building or something catastrophic, can they recognize danger? And if they can, but they're unable to get out, if they're bedbound, they might have all of their faculties. They know the room next door is on fire, but they can't get out. So that person would be considered directed care. So that's the highest level of assisted living. And they just have more supervision than the group homes I'm talking about. They have more supervision. It's a smaller environment. The maximum number of residents in a group home is 10 versus you can have 60, 100 residents in a larger assisted living community. And then the staff, if there is a fire, the staff is all hurrying to get all of those residents safely out of the building. And they can both help with activities of daily living. And they usually have the basic room and board, and then a level of care. That's in the assisted living communities. In the group home, it's all bundled together. Okay, next. Hope you're writing down your questions. I'm sure there'll be lots of questions. Yeah, memory care is obviously for individuals who can no longer take care of themselves, either themselves or most of the times it's the spouse that they know that they're tapped out. They have held on to their spouse as long as they can. They promised, and it's usually a very emotional decision for somebody to help move their loved one into a memory care community because they promised them they would never move them. But it becomes a true physical burden on the one that's giving the caregiving. It's just too hard. Maybe the person is fighting that. A lot of times people that have Alzheimer's, they fight. They do not want to get into a shower, and it just becomes a real struggle. And especially when you're dealing with larger people, whether weight-wise or height-wise, it becomes a real strain on the spouse or on the adult children who are filling in to try to keep mom or dad at home. So that's when people look into memory care. There's typically more training for the caregivers. They are required to do annual continuing education units about memory care. And that price range that's on that sheet is still pretty accurate. I would say where it says typically $4,000, you could still get into a group home possibly for about $3,500. And then it goes on up from there. The communities are a little bit more. And none of this is covered by Medicare. The only thing that covers the cost of care for this is a long-term care insurance policy. And then remember, you have to have at least 2 of those activities of daily living. Okay. Let's see, next. Yeah. Then, of course, with skilled nursing, that is covered under Medicare. And I think I touched on that. They will keep you for, depending on what the need is, like if it's for a broken hip or you've had a hospital stay and you just need additional time to recover before going home, you have to prove to Medicare that you are improving, making strides in your recovery and not plateauing. If you're at the skilled nursing facility for a week, and sometimes people are just too fatigued to continue with their physical therapy, they will, the therapist will come in and say, Mr. Jones, come on, it's time for your physical therapy. And if they refuse, if they're just too tired and say no, they will document, Mr. Jones refused therapy today, and you get 2 and then you're out. You also have to prove that you're making improvements. Otherwise, it's called plateauing, and they will, you'll get the notice, the 48-hour notice that, Mr. Jones will be discharged this Friday, even though the family thought they had the full 20 days. And as it says, the coverage is for short-term up to 60 days, but don't count on 60 days. And long-term, well, and it's very specific to the reason you're in there, but if you have any questions on that, we can talk later. And then the next slide regarding the skilled nursing is financial planners can help with long-term care policies and different models. Some are asset-based. And like I know the larger communities here around in the area, the Colonnade and the Sun Health properties are different than Royal Oaks. So if that's what you're looking for, I suggest you sit down with your financial planner and talk about what you would specifically be looking for yourself, what you wish to leave for your children or your heirs or foundation, because some of them do not give back any of the those large sums of money, and they're typically several $100,000 and more to move into the buy-in communities, those CCRCs that have the skilled nursing on site. But you definitely need to talk to your financial planners about that. And the next slide talks about the continuing care retirement communities, and they're beautiful. I love them. I wish I would be able to move into one when I'm when it's time for me to move into one, but I don't think that personally, my husband and I have the assets to move into one. So again, I'm going to put it back to you and your financial planner to see if that's something that you can afford. And the benefit of a CCRC is it has all 4 of those levels of care right there on the campus. So if you're going into one as a couple and one of you changes your level of care over the course of your time living there, one could still maintain that independent apartment on the large campus and be going out with their friends and going to the dinners and activities, while the other one might be in skilled nursing or have moved on to a memory care, but they're on the same campus. And typically with a continuing care retirement community called life care communities, the rent is less than if you go into a straight assisted living place. Not always, but it's a little bit less. And that's because it's offset by that large portion, that buy-in portion that you're putting down when you first move in. And they will also make sure that you're physically able to move in there. So they're looking at your financial health, and then they're looking at both husband and wife, your physical background and your health background. Okay. Oh, yeah. Well, obviously, if you're going into skilled nursing, your Medicare is covering that. So if, however, after your Medicare days have been used up with skilled nursing and you're in a continuing care retirement community, a lot of times the policies, and they're so specific, you have to read them, they will cover continued care in their skilled nursing facility. So, but there's very few reasons somebody needs to stay in a skilled nursing facility too long. I mean, there's certain conditions, but most of the care that we associate somebody needing to go into, and what the old term was nursing home for, are all those activities that I mentioned when we first started: the dressing, the bathing, the feeding, helping with incontinence, transferring. They're not really skilled needs. That's what they call activities of daily living, or what's the term they use? It'll come to me. See, I'm having a senior moment. But those are not true skilled need. Like just to continue to stay in a skilled nursing facility for those needs, custodial care. When that's all you need, they say that you need to move on to a custodial care environment, which is a group home or an assisted living community. Okay, so now we're up to the group homes, and they're licensed for 5 to 10. Some of them are called foster homes, and the owners live in the home with you, and they're licensed for 4 residents or less. There's a lot of those in Arizona, and they are also overseen by the Department of Health Services and through the Foundation for Senior Living. Any home, the foster homes always accept Medicaid. They have to. They're a foster home, and they're licensed through the Department of Health, but they're overseen through Foundation for Senior Living. So foster homes, the smaller environment, they have 2 entities overseeing their care. So they get 2 inspections a year, whereas the group homes and just the plain assisted living communities can expect 1, or I should say a minimum of 1 inspection per year from the Department of Health. And they come in unannounced, and they ask for the records and they go through them, and it's quite difficult to get a 0 deficiency report, and they all strive for that. Most of them get a couple little citations here and there. When I'm doing a tour, setting up a tour for a family in anticipation of somebody needing to move out of their home, and I will have conferenced with them either in person or over the phone. I find out from you what type of environment seems preferable to you. Some people that are not social butterflies and they don't need all of the activities, and they're not going to go down to the bingo games and the music programs every week and happy hours and whatnot. They just want to be left alone. Leave me in my room. I'll read a book. I'll watch TV. I'll come out for meals. A group home is perfect for them, and it's usually more affordable. So I will conference with you, and then I'll pull out the reports, the latest state reports, and the state reports are visible to me, and actually to you. They're just a little tricky to get into. So I will pull out the latest state reports of any place I'm taking you to go look, and they're available for the prior 3 years. So I currently, if somebody's had their 2020 inspection, that's available, but it's only April. So I'm looking at 21, 20, and 19, and I'll pull all of those out. They'll also tell me if the home has had a complaint, what the complaint was about, if it was substantiated or unsubstantiated. The Department of Health always has to go back to the home, go back to the community, and do fact finding, some CSI work, and see if the complaint was valid. Let me see what it provided included. Yeah, so group homes always include 3 meals a day and snacks in between. They do the laundry. It's like moving in with your adult child. They just take care of you. With the assisted living, if you're in assisted living, they give you the 3 meals a day. And in independent living, some of them only give you 1 meal a day, and you're independent. So, if you could make your own breakfast, you could go down to either lunch or dinner, and they let you choose which one you want to go down to. Some independent places actually allow you to go down for 3 meals, but they're rare. Next slide. Again, that number you see there for the cost, average $2,300 a month. I'm going to have to up that to about $2,700 a month, and that is for a shared room. And the reason it has come up in price is because Medicaid now reimburses the homes at a higher rate than they used to. The group homes went en masse and petitioned that they're doing the work, or the majority of the work, that the skilled nursing facilities are, and yet the skilled nursing facilities were getting tons of money or not tons, but a lot more money than the group homes were. So now they're being reimbursed at a higher rate. So they can't, they don't want to take in somebody at $2,500 anymore if they can get somebody for $2,700, and that's for a shared room. Sometimes individuals don't want to share a room, but they need to go on to Medicaid. So if their family members are able to chip in a couple hundred there and get them up to about the 3,000 mark, then we could look at a small private room for them. Okay, next slide. Oh, was this the next slide? Oh yeah, okay. Your own home. So you've got to look at, if you're looking to transition, what are the things you're going to have to be looking for, and the costs of it. If you keep your own car and you keep up the insurance, if you're bringing in a caregiver to your home just to help you here and there, and with that caregiver, also put in the cost of the maintenance of your home, landscaping, all of that, the cost of your meals. Do you have a housekeeper coming in? Do you have a cost for, and I shouldn't have medical and dental services in there, because that doesn't really have anything to do with the cost of your home. But when you're looking at, can I afford assisted living? Or, I do have a cost sheet that I can send you, and it's got everything delineated from the cost of cable, insurance, all those things. And you'd be surprised how many people are like, oh, I guess I can afford it when I'm not paying for all these other things. Okay. Yeah, get your papers in order. If you don't already have children or spouses to be your powers of attorney for both healthcare, financial, and mental health power of attorney, I would suggest you get that in order, because you don't want people to be scrambling at a moment of crisis. And in Arizona, in some states, you are able, if somebody's got a healthcare power of attorney, that includes a mental health power of attorney. In Arizona, you have to have a specific paper stating you are giving your loved one that power of attorney to make decisions to put you into a memory care facility, or even more so to a geri psych hospital. If you're exhibiting strange behavior and it's just unlike you, could be a urinary tract infection. Well, that's easily fixed. But if there is a diagnosis of dementia and Alzheimer's and myriad of different things, and just kind of having a very difficult time with behaviors right now, they are not allowed to admit you into a hospital without that mental health power of attorney. You would have to be taken either by an ambulance out of the home, and then you incur those costs, or I would say to go into the emergency room, but usually the people that are fighting because they're having some delusions or hallucinations, they're not willingly getting into a car to go to an emergency room. So it's just really important to have your papers in check. And your financial and family, just make sure that your family knows what your wishes are. Simplify your home, get rid of stuff early. Don't wait until a crisis, because your precious valuables and collectibles may not be distributed as you had envisioned them to be. And while you're doing this, get educated on what options are available. So I hope I'm helping a little bit there. And now we are at the question and answer time.